Warfarin is an anticoagulant medication, or blood thinner, that stops harmful blood clots from forming. It also stops existing clots travelling to other parts of the body. You may be prescribed warfarin if you are at risk of developing a harmful clot or if you have an existing clot. Some of these conditions are deep vein thrombosis, or DVT, which is a clot in the leg or arm, pulmonary embolism, PE, a clot in the lung, atrial fibrillation, an irregular heartbeat, heart valves, and other conditions. Take warfarin at the same time every day in the evening with a glass of water. Warfarin tablets are colour-coded. They are available in 1 mg light brown, 3 mg blue, and 5 mg pink. You need to know exactly what dose you're taking in milligrams and not just the colour. You should always stick to the same brand of warfarin. Let your pharmacist know if you are given a different brand. You must have a regular blood test called an INR, International Normalized Ratio. Your dose will depend on your INR blood test. This will be taken regularly by your GP or at your warfarin clinic. The length of time you need to take warfarin varies and will depend on the reason you are taking warfarin. If you miss a dose and remember it on the same day, you can still take that dose. Check your patient information leaflet or speak to your pharmacist or nurse. Never take a double dose to make up for a missed dose. If you are regularly missing doses, speak to your doctor. If you take too many tablets, you must contact your GP or warfarin clinic immediately. Because warfarin increases bleeding risk, there are some necessary lifestyle changes. You should avoid any activity or sport that may result in a serious fall or injury. If you get a cut, apply pressure immediately and seek medical advice for serious bleeding. Keep a healthy and balanced diet. Foods high in vitamin K, such as leafy green vegetables, liver, and some oils can affect your INR. These are safe and very healthy, but you should keep to roughly the same amount in your diet. Read the warfarin information booklet for a list of foods that can affect your INR. Avoid drinking grapefruit juice, cranberry juice, or taking cranberry products. If you plan to change your diet, take new herbal teas, supplements, or juices. Speak to your nurse or pharmacist. You can drink very small amounts of alcohol, no more than 2 units a day. It is dangerous to binge drink when you are taking warfarin. If you give up alcohol completely, inform your doctor. You can travel, but you should inform your doctor as you will need to have your INR checked. If you're traveling for an extended period, you may need to have your INR checked while you are away. Warfarin is not usually used during pregnancy, but may be used rarely for certain patients. If you plan to become pregnant or think you are pregnant, contact your doctor straight away. Warfarin may be used during breastfeeding, but should be discussed with your doctor. If you are undergoing any medical procedure, no matter how small, it is important that you let the healthcare provider know that you are taking warfarin. If you are having a tooth extraction, contact the warfarin clinic or your GP at least 1 week before so that an INR test can be done. Always check with a pharmacist, nurse or doctor before starting or stopping any prescription or over-the-counter medication. Avoid anti-inflammatory medications unless they are prescribed by your doctor. Examples include aspirin, diclofenac, ibuprofen, and naproxen. All medications carry a risk of side effects. Some side effects are mild, like minor bruising or feeling colder than usual, but others require urgent medical attention. Seek immediate medical help if you experience heavy bleeding that won't stop, coughing or vomiting blood, blood in your urine or stool, severe headaches, dizziness or weakness. If you have difficulty breathing, swelling of the face, lips, throat or tongue, or severe bleeding, call emergency services immediately. Dial 999 or 112. For a complete list of side effects, refer to your patient information leaflet. and discuss any side effects with your pharmacist, nurse or doctor. Taking warfarin safely means monitoring your iron ore with blood tests, keeping a steady diet, and watching for signs of bleeding. If you ever have any questions, speak to your doctor or pharmacist. For more information and patient support, please contact the Irish Heart Foundation, now supporting patients through their blood clot recovery.